Before examining the patient, it is mandatory to wash your hand properly. First, to introduce yourself and know the name of the patient and the age of the patient. In this pandemic, it's compulsory to sanitize your hand regularly. Let's start the visual acuity test. The distance between the patient and the signal chart should be at least 20 feet. The patient should cover one eye and should read the smallest possible word with the other eye. The same with the other eye. First, inform the patient about the process. Put your wiggling hand lateral to the ear of the patient and ask the patient to inform at which point he saw your wiggling finger. Now examine the lacrimal gland, sclera, conjunctiva. Put your hand lateral to the ear of the patient and slightly move forward and inform the patient the point at which he saw the red point. The same with the other eye on the other side. Before examining the light reaction, it is mandatory to darken the room first. Focus the light on the eyeball and closely monitor the changes in the pupil or the ciliary muscles. Instructing the patient to see on your shoulder. Hold the pen to 10 cm away from the eye of the patient and instruct the patient to monitor closely on the tip of the pen. Now assess the ocular alignment. by standing 2 feet apart from the patient. Shine a light on the eye closer to the nasal chamber. Ask the patient to follow your finger as you sweep through the 6 cardinal gauge. By making the wide edge. Examine the eye of the patient with the ophthalmoscope. Examine the right eye of the patient with your right eye and right hand. With your left hand and left eye, monitor the left eye of the patient. First, monitor the auricle. Is there any pus or is there any lesion? If there is pain, any discharge is present. Do the duct test to test the otitis externa. Put the vibrating fork on the top of the head of the patient. Now perform the Weber test. Ask the patient if there is any louder sound in one eye or both eyes with the same sound. Now perform the linear test to compare the air and the bone conduction. Put the vibrating fork on the mustard bone. If patient asks the sound is no longer heard on the mustard bone, immediately put the tuning fork on the ear canal. Now examine the ear with the otoscope. Slightly move the pin outward, backward, and upward to straighten the middle ear. Examine closely if there is any cerumen present or redness of the skin or foreign body. Note the color of the eardrum. Perform the same with the both ears.